the power of distraction with rabbits. So keep giving them food, get them out of the small cage, put them in a pop-up run to run around so that they can actually exercise. With regards to analgesia, you've got quite a lot of options. These are your two most common options, and these are some of the most current dose rates. So meloxicam is 0.3 to 0.6 mg per kg twice a day. Okay, so it's really important. Is everybody using Metacam twice a day?
If it's the 0.6 mg per kg one,
yeah.
Is it still, so say it was like, I don't know, 0.9
yeah.
mils, but we only do it once a day, so is it
twice a day?
Twice
yeah.
a day.
So regardless of the dose you're giving, it's only lasting up to 12 hours. It's being metabolized after 12 hours. So that's quite a common thing actually, that people think when they get higher up the dose range it's just once a day, and all you're doing is you're hitting it really, really hard for half a day and then nothing for the other half of the day. So you'll get...
lasts for 24 hours?
No, nothing lasts for 24 hours.
See, everyone's trained that meloxicam is for 24 hours and you shouldn't be giving any more after 24 hours.
Cats and dogs.
Yeah, but rabbits who only recently started giving twice a day recently.
Yeah.
So they should be starting oral a lot earlier?
Yes, yeah, absolutely, the next morning.
We give an injection at 2, they won't start it until 2 the next day.
Yeah. And how are you finding many post-op complications? Are you finding many people that they're not eating, they're doing all right? And that's good. That's good. It could be that your pain relief throughout your procedure is a little bit better. You've got more cover, which is getting them through it, or you could just be lucky. But yeah, it's one of those things. Definitely twice a day. It can be used once a day, but certainly studies are showing that the levels you have to give it at to get the plasma levels are supremely high, above 1.5 mg per kg,
so it's
twice a day.
And oral is twice, recommended twice?
Yeah, yeah. The pharmacokinetics of that particular drug just gets metabolized within 12 hours, regardless of how you give it.
But routinely, for spays and castrates, we just sort of, it's once a day, but I think like when we had a rabbit with Gladstones, that obviously was twice a day.
Okay.
That one we upped it because it's a different problem. Yeah,
definitely take it back to your team and discuss, regardless of how you're using. If you're using meloxicam, it's twice a day. So, and there are, there's information in the manuals out there that you can pick up on that as well, and certainly the most recent lectures and things that you'll go and do from Molly Varga and Kevin Eatwell, John Chitty, all the kind of rabbit gods that are out and about there doing that. So it's one of the things that is most commonly seen, and I do a lot of work on social media, and I get a lot of clients, your clients, anybody's clients, come to me at kind of, silly o'clock at night going, oh, it won't eat, it won't this, it won't that. And again, working with our clients to get them used to what needs to be done, helping them through and giving them someone to reach out to is really important. But keeping up to date with our dose rates, because they do change. So for example, paracetamol is used in rabbits. It's really, really good. The published range for paracetamol is 300 to 500 mgs. So a rabbit would take the same amount of paracetamol that I would, which is mad. In theory, Molly Varga uses 30 mgs per kg up to 4 times a day. But it can work really well. You give it alongside the Metacam. So again, you can aim to keep those Metacam doses around the 0.3, 0.4, but you can add in paracetamol, you can add in tramadol, gabapentin, methadone, fentanyl, all these other bits and pieces, because we need to use multimodal analgesia. It's really important. Otherwise, if all we've got is a hammer, everything looks like a nail. Okay, we're just not sorting out that animal's pain. We need to think about how meloxicam work, how NSAIDs work, which bit they work on. Are they good for visceral pain, or are they better for orthopedic pain, or how is this working? And know what we've got in our toolbox to use. Buprenorphine is probably the next one that you use most common, certainly if you're tripling and doing things like that. Either buprenorphine or butorphanol are the ones that people most commonly use. Again, just check the dose rates, see what you're using. 0.01 to 0.05 is common. Quite often you only need the 0.01s, 0.02s, the lower end of the dose. If you're getting higher end of the dose, there can be a bit more sedative on the Vesgesic there. Okay, and Q6 hours. 6 to 12 hours. So, you know, if you've done that rabbit first thing in the morning, by the evening, it could potentially have another shot of bute before it goes home. And that could then give it a bit more cover overnight. So think about it. Is anybody using local anaesthetic in their rabbits?